as we mentioned, I was going to talk to you guys about some of the current research studies that we have going on in here in Rochester. When I was putting this together, though, I thought I would kind of take a two-prong approach, which is tell you about the clinical trials, but also kind of take you through what we do during a typical trial, maybe demystify it a little bit, and explain how we could possibly spend 6 hours together and keep you very, very busy. So here in Rochester, the first thing, these are the coordinators when you call about a research study that you will meet. Apparently, I only have one outfit. And besides me is Jim and Liz, and Jim is currently here right now, and Liz will be here in the afternoon. So one of the first things we have, this is kind of overarching, it's the National Registry for Myotonic Dystrophy for type 1 and type 2. We're the longest running registry. We're approaching 20 years, actually. And this has a couple purposes. One is to get information out to you guys about current research that's taking place. If you want to sign up for the registry, your name will go in the database. If someone's conducting a study, they'll let the registry know, and they'll send you a letter with all the information. If you're interested, you reach out to the research site. They don't give out your information. They're more of a conduit to get you the information about what's happening. The other piece of it is they will also take a questionnaire from you about your symptoms, any medication, how your disease is progressing. And then next year, they'll send you an annual update and say, these were your answers last year. How has anything changed? And with that data that we have been collecting for decades now on some patients, we can write up scientific articles for other doctors and other research institutions to look at. So it's been a very helpful on both ends from patient and our perspective. So as I mentioned, Jim and Liz are the primary coordinators on this, and they will both be here today, and I believe they're going to set up their table during some of the breaks, so you can find them. And I should mention, in addition to myotonic dystrophy members signing up, unaffected family members can also join. So the first study is our study in myotonic dystrophy type 1, which you'll hear us refer to as the END study. And this is the study that is taking place in the network that both Dr. Thornton and Sarah mentioned. We're going to track people for 2 years in the US and Europe, and we're going to enroll 650 people. And some of the reasons for this study are to take measurements of your muscles and how they're functioning, and also some of the genetic testing, like Dr. Thornton was talking about. And as we know, there are huge differences in how DM affects everyone, especially in even families, and why is that? Also, some of the buzzwords you may hear lately are biomarkers, or those markers of myotonic dystrophy, which is really the chemicals that are taking place, making the changes take place in the muscle tissue. So we would look at that as part of this study. And then, do changes occur more rapidly in some patients than others? And if so, why? So this study, like I said, is over 2 years. We come in for a first visit. We see you at 1 year and at 2 years. Now, this study also has a very small portion with a sub-study that you can provide a micro muscle biopsy. And if you happen to do that, there's a 3-month visit as well. So part of this study, we would have you come in and you would see a neurologist for a brief exam. We would do an EKG to look at your heart. Of course, we would test your muscle strength. We would look at your myotonia, some blood work, questionnaires, which are really to get out how do you feel the myotonic dystrophy is affecting your day-to-day activities. A computer test to look at your thinking. And if I said willing and appropriate, there is that micro muscle biopsy for a small portion. And then we also have a study for myotonic dystrophy type 2, which you'll hear us refer to as the STOP study. This also had a DM1 component to it, and we have completed enrollment for that one. So right now, this is just here in the Rochester site. It's over 3 years, and we're going to enroll 50 people. And you'll notice some of the same reasonings here. Look at your muscle function and the genetic testing, what chemical changes, those biomarkers again, but this time for DM2. Find reliable ways to measure how the disease affects people. Like Dr. Thornton mentioned, you know, if a drug is able to change the course of the disease, are we going to be able to pick that up? and how is the disease changing over time. And this one's a little bit longer, it's over 3 years, so we see you at the first visit, 1 year, and 3 year. And again, mostly the same items. The difference in this one is this one also has a DEXA scan involved. Some of you may have heard of that when you go for osteoporosis, we can look at bone density, but we also get a muscle measurement from it, which is what we're more interested in looking at over the 3 years. And everything else is the same as the other study. So if you were able to come into a study visit, what would a typical day look like? First, we're very lucky here. We have a clinical research center. It's right at the front of the hospital, but it's only for research, so it doesn't have that same hospital feel to it. And there's parking right outside the research center, which anybody that comes here knows close parking is a hot commodity. So when you first come in, you would meet with one of the 3 coordinators that I showed you. We would go over the consent form with you, which is really the official document of the study. Kind of explains why we're doing the study, the procedures we're going to do, if there's any risks. It's your time to ask a lot of questions. And then once we've done that, you'll see our CRC nursing staff. And again, we're very lucky. We have a nursing staff that's just here for research studies. And for those of you who have come in, you will recognize 2 of our more popular nurses. But they'll come in and they'll do your blood draw. We'll get that EKG and take your vitals. And this is the DEXA scan for those of you who haven't seen one. You lay flat on the table and the scanner just slowly goes over you. We have had people take naps on there. And then you will see Dr. Hamill, who is also here today, and she will be talking later. And she'll do an exam, kind of like what you see in your clinic visits. We'll go over your history, what symptoms you have, when did you first start having symptoms, and an exam to test some of your muscle strength, your reflexes, and your myotonia. Then we give you a nice stack of homework. But like we said, we have several variations of these questionnaires because, again, we're trying to figure out which ones are going to capture that change if we have a good drug study. So these, again, are getting at the different ways that myotonic dystrophy affects your day-to-day activities, your working, your swallowing. Then we have a new test that's kind of new in the last couple of years. It's called Cogstate. It's kind of like playing computer games. There's card flipping games and some mazes, and this gets at trying to look at some of that brain fog or cognitive issues that we notice in myotonic dystrophy. Then, as you can imagine, with a muscle disease, the biggest portion of your day will be spent with our physical therapist. And we have 2. We have Katie and we have Lindsay, and Katie is also here today and will be speaking later. And this is some of the things we'll go through. So she'll spend time doing 2 kinds of muscle testing with you. The manual muscle testing is more what you see in clinic. You push and pull against the hand and get a score. And then we also have quantitative muscle testing, which you kind of do the same thing, but it's against a pulley, and we get a very accurate measurement on a computer. Then we'll do some breathing tests, sitting up, laying down, where you just have to breathe through the machine, try to look at your lung function. Some mobility tasks. The very popular one, if you've been in studies, is the 6-minute walk test. Walk up and down the hallway at a comfortable pace for 6 minutes, and we see how many laps you can do. Then there's a 30-foot go, which is go from the start line to the stop line as fast as you can. And then just some functional tests. How difficult is it to get from laying down to sitting up on the table, from getting up from a chair, walking, turning around, and coming back to your chair. Looking at how your legs work, going up and down the stairs, up and down on a stair block. And then, of course, looking at the finger weakness, picking up quarters and holding them in your hand, putting little pegs in the hole. And the one on the far end is a variety of them, stacking checkers, moving some cans of different weights, that kind of thing. And then the big one, myotonia. We measure that several different ways. On the far end is what we call percussion myotonia, which you'll do with Dr. Hamill in the physical exam, in which she'll tap on your muscle and see how long it stays contracted. In the top middle, we have you squeeze a handle and release it. And that one's also connected to the computer to get a measurement of that relaxation time. And on the bottom, what we call VHOT, a video hand opening time, where we just have you squeeze and relax your hand, but we take a videotape of it so we can put it into software and try to score how long, a very specific measurement of how long the relaxation takes. So that being said, there are several people here who have been in the study visit. I have also done all of the procedures for street cred. So if you have any questions about any of the procedures, don't hesitate to ask any of us. Here's my information. I will also be around today, and I've brought information on both of the studies. And like I said, Liz and Jim will have information about the registry. So swing by and ask us if you're interested.